Hey everyone, we are going to change Pale Dale's dressing. He's got an abdominal wound, and we're going to take out the old one, clean it, and put in a new one. So before we get started, we want to check the patient's chart. Of course, we want to make sure that we have an order to change the dressing and what kind of dressing it is, so we know what kind of supplies to get. We also want to check his chart for allergies, especially making sure that he doesn't have a latex allergy. We want to make sure that we're not using latex tape or latex gloves if that's the case, if they're allergic to that, or that any of our dressing supplies we're using don't have anything like that. If there's a medication that we're going to actually be embedding inside the wound after we clean it, we want to double check that medication too and make sure that he doesn't have any drug allergies that we need to be aware of before we apply that. So we've done all those things. I've already come into the room and washed my table down and cleaned it, let it dry. I gathered all my supplies, so I'll go over that. I actually have 3 pairs of gloves. You would just have gloves in the box, obviously you would pull them out of. I have an ABD pad. They come in different sizes. This is kind of your standard size. They do make some larger ones in case you have a really large wound. I've got some normal saline here. I've got some rolled gauze. I've got my Q-tips. I also have some tape. I've got an ink pen for when we're all done, when we put our name, date, and time on it. I've got some scissors. I've got a wound measuring device, my hand sanitizer. You can also use soap and water at the sink. I've got a trash can and some gauze 4x4s. You'll need several of those, some for cleaning and then some clean ones for at the end to put back on your clean dressed wound. And I also have a towel here. So we're going to go ahead and get started. Before doing all this, you want to have explained it to your patient and answered any questions that they have. And we also want to check and ask them about pain. We want to know if they're having pain now. And most importantly, we want to know if doing the dressing change usually causes them pain, if they've already had the dressing change done before. Some wounds are more sore than others. If they're wanting some pain medication, we want to give that enough time to work. So we're going to want to do like 20 to 30 minutes before you do the dressing change. So if you've forgotten to ask, and you do ask and they want some, you might have to be put off doing the dressing a little bit until you have the pain medicine that has time to work. All right, so Mr. Dale, we're gonna go ahead and change your dressing now. Your medicine's kicked in. It's been about 20-30 minutes since I've given it to you. I'm gonna take just a clean towel and set that here and lift his gown and use a sheet to kind of keep him covered so that we don't expose him, he doesn't get cold. We are doing a clean dressing change, not a sterile dressing, so I'll be using clean gloves. And just to speak to that, even though we're doing a clean technique, the supplies are sterile when they're in here when we first open them, and we're going to do our best to keep them as clean as possible. Changing your gloves, washing your hands in between, and just not contaminating with the stuff that's around us. So once we've gotten our patient prepared, I've done my hand hygiene already. I'm going to go ahead and put my gloves on. Okay, he has Montgomery straps, which we have talked about before. Some wounds, they are being changed frequently and for a long period of time, and we don't want them to get a breakdown in their skin, so we might use Montgomery straps. More often than not, it'll be a dressing that has tape on it. All right, we're gonna open those up. We wanna try and keep these as clean as possible. I'm gonna set those straps off to the side and open that up because the goal is to not have to change those Montgomery straps every single time. So we know he's got an ABD pad down already. He's got some 4x4s there. I'm gonna go ahead and pull those up. You do wanna take note of the dressing and the dressing that you're getting ready to take out of the wound bed. Note what color it is, how much drainage is on it, is there an odor, that kind of thing. And we're going to go ahead and take out, very gently, take the dressing out of the wound. So let me speak to that. If the dressing inside of the wound is sticking and you're having trouble getting maybe that last little bit out, we don't want to just pull on it because we might accidentally pull some of the healthy tissue too that started growing, and it's going to be painful. So if that's the case, we would take some of our normal saline we would take it, we would pour a little bit of that in the wound bed, and that might help loosen it up and have it come out much easier. I've got a trash can. You may have one on the floor next to you. In this case, I have a trash bag that we're just going to throw away, and I'm going to set my stuff inside of there. You can set that near the patient, or like I said, just use a trash can on the floor. At this time, we've taken our dressings out. We can look at the wound bed. I actually like to look at the wound bed and measure and take note of that again later on after I've cleaned it, because you really truly can't see the wound bed until once it's really cleaned and you can truly see what it looks like. But do make note of the drainage and how much, because you'll be documenting that in the patient's chart later when you're all done. So at this point, I'm going to go ahead and take my gloves off and throw them away. You can either go to the sink and wash your hands with soap and water, or you can just do the hand hygiene that's on the wall. So I'm going to do that. I'm going to check in with my patient. Be sure that you check in with your patient as you're doing it too. Ask them, how are you doing? Do you need me to stop for a minute? Do you need a break? Do you need to catch your breath? Especially if it's very painful. So I'm going to go ahead and put on another pair of gloves. And now we're going to clean our wound. So like I said, I think in the steps of your rubric, it does speak to going ahead and assessing your wound bed. You can take your wound ruler. We want to measure it. Remember, it's always the greatest points that we want to measure. So I would measure from one end to the very next, and the widest width of the wound. As you can tell, from here to here, it's a lot more narrow. The widest point on this particular wound is really from here to here. So I take my wound measure and measure how many centimeters wide and how long that is. We also want to measure the depth. And for doing that, I would take a clean Q-tip. I'm going to put the Q-tip down at the deepest part of the wound and put my fingers right at where the end of that is. So from here to here is how deep this particular wound is. And then you would take your wound ruler and you would measure. And this one here is approximately 3.5 centimeters deep. So then you have your length, your width, and your depth. And all this stuff, of course, is disposable, and you can throw that away, including your wound ruler when you're done. A lot of times I just remember my numbers, or I'll have a towel and a pen that stays in the patient's room for wounds, and I'll write down, if you can't remember the numbers, I'll write them down on a towel and then transfer them into the EMR later on. So we need to get this wound clean. You've got your ABD, and you notice I open it up. I don't take it out and mess with it too much right now. I want to keep it clean, but I'm just opening up my packaging. I've got my normal saline. I've got my 4x4s. Okay, so we want to clean our wound, and there's a couple different ways we can do this, and sometimes your order from the physician might specify to that, and if not, it might just say to clean it with normal saline. Some facilities have normal saline for wound cleansing and dressing changes, and it's in a spray bottle. And the spray, when you actually take it and you spray the wound, actually helps get some of that loose stuff off. It helps irrigate it a little bit and helps naturally kind of debride that and get that off just from the cleansing. You can also take a syringe with normal saline in it. You want to be careful though, because when you first open up those syringes and push them the first time, they kind of stick. So sometimes I'll point at the trash can and start it there, so that when it comes out real fast and hard, it goes into the trash can. And then I'll come over here and gently squirt it up and down. And when you do that, you'll take your 4x4s, because you're going to be using some of your 4x4s to collect that normal saline and pat and dry. In this case, we've got normal saline like this. And you can either pour it in the wound, or you can pour it directly on your gauze little 4x4 pads. And you're going to gently, either from top to bottom, and you'll use a new one each time. And depending on your wound, depends on how much you need. If you get too much excess, you can hang it over the trash can and drip some of that out. Of course, you can always use your normal saline. You want to go from top to bottom, and you also want to go from inside the innermost part of the wound to the outside. And I'm going to use one more. Notice I'm not rubbing the wound. That would probably be really tender and really sore on the client. So I just kind of do a pat, and I check in with my patient and find out, are you doing okay? All right, once we have that done and our wound is done being cleaned, I'm actually going to remove my gloves one more time. I'm going to do my hand hygiene. And I'm going to put new gloves on. Now at this point, your wound should be nice and dry. I actually see a little bit of that normal saline sticking to the side. And I want to pat that. We want the outside of the wound, the peri skin, to be nice and dry. So I know I spoke earlier that your rubric speaks to measuring your wound earlier on. You can measure your wound then, or if you want to measure your wound now after you've cleaned it, this is actually a really good time to do it, because now you have a clean wound bed that you can see really well, and you know what it really looks like down in there on the inside. Now that your wound is clean and dry and we're ready to dress it, if you have an area that we've spoken about before on the outside of the peri wound that might get kind of white, maybe have maceration and be getting too much drainage on it, you can always take an emollient or like a skin barrier cream and put it just on the outside on the good healthy tissue. We don't want to get it inside the wound. We just want to put it on the outside. That way, if there's too much moisture, that'll help protect the good skin and keep it from going bad and getting too moist. If there is a medication that has been ordered by the physician to put into the wound, now is when we would do that. I usually use a Q-tip or sometimes a tongue blade that I take out of a clean package, and I'll put the medicine on there and apply it to the wound bed at that time. Once you're done doing that, you'll have your clean gloves, and we're going to go ahead and dress our wound. So we are doing a dry, clean dressing. So this gauze I'm putting in will be dry. If the doctor had ordered a wet to dry dressing, if that was the case, you would take your normal saline, pour it in there, wring it out, and then be putting this into the wound wet. For today's purposes, we're doing a dry dressing. I take my Q-tip and I take my gauze. We've washed our hands. We've got clean gloves on. And I'm going to take the tip of it and I'm going to use my Q-tip to help get this into the wound bed well. I'm going to start here at the middle of the wound. And we're going to kind of pack that. It's a little bit trickier when the gauze is dry. You'll notice I go to the end. We don't want to pack this too tight. However, we do want to get all of the inside of the wound bed done. And this isn't something you do super fast. It does take a minute or two. You want to make sure you get to the very end of it, because if we just have a wound that's packed like this, and then when you're all done, you've got these wide open spaces on the end and they're not filled in. We spoke to that. You're going to have problems with the wound not really filling in and healing with healthy tissue. So we want to make sure that when we do pack this, that you've gone all the way to the end, and when you're all done and you look at it, that the whole entire wound is filled in. If the physician orders a wet to dry dressing, this is a little bit easier to do. Your dressing will sit into the wound bed a little bit easier. It'll be a little bit heavier with the normal saline in there. And we're just about done. I'm going to throw my Q-tip away. And then we're going to get some scissors. So the scissors you grab would have been in a package. I would have opened them up so I could readily grab them when I'm ready for them. If this was a sterile dressing change, you would have sterile scissors, you would have sterile gloves, and you would keep them sterile in here until you were done. We're using clean scissors. So the first time I get these scissors, I open them up they're sterile in the package, and then when I'm done, and if we're going to reuse them and not get new scissors every time, we'll clean them with alcohol and then put them back in the package and save them for the patient's next clean dressing change. I'm going to go ahead and cut our gauze here at a good spot. Make sure this is tucked okay. You notice how it's nice and filled in. You want to make sure that you've got enough gauze in there that it is filled in. If you had it again like this and you could see a lot of the edges exposed and it wasn't filled in good enough, you're not going to have good wound healing. So now that we've got that on there, I like to take 4x4 gauze, especially if a dressing has a lot of drainage. It's nice, you don't have to, but a lot of times you'll see nurses putting the extra 4x4. Sometimes the physician will order it, and I'll put the extra 4x4 gauze on top of there in case there's some excess drainage. And then we'll take our ABD pad that we have, open that and lay that across. They're pretty absorbent. As you can see, it's a much thicker pad. We're going to want to take our tape and our pen. Obviously, I don't want to write directly on the wound, so a lot of times I will have written my name and date on there, and I'll do the time afterwards or before. Or you can take a piece of tape and write on the piece of tape and then put that tape across the dressing. And just remember, you want to have the date, the time, and your initials on that. And then we're ready to close this back up. We'll close, either you'll tape your sides, or if they've got Montgomery straps like he does, you'll close these back up and you will rethread them. And that's it.